moderator Simon Turner is based in Paris and is currently a partner at Socanova Partners, which is a leading European venture capital firm in life sciences, specializing in healthcare and sustainability. So I'm going to go ahead and pass things over to you, Simon.
Thanks very much, Angela. Well, everyone, you know who I am. Thank you very much for being here this evening and afternoon in your cases. I'm joined by a fantastic panel, and we're doing this a bit of a transatlantic esprit here. So you've got April and David who are sitting in the US, and then Liggy and myself here in Europe. So again, good afternoon, good evening to some of you, and possibly good night to others. We'll see. Our topic tonight is really something that's quite interesting and obviously very relevant given everything we've gone through for the last couple of years, and really focusing in on how COVID has impacted us. So we're talking about AI and big data in healthcare and how it's actually impacted us in terms of an innovation standpoint. So before really diving into the topic, I'd love for our panel members to actually present themselves. So if you could perhaps start, Ligia, and then I'll ask April you to kick off, and then David as well to finish off.
Thank you. Thank you. It's nice to be here with you today. I'm actually right now during my holiday on Crete, so it's 10 p.m. And I'm in the hotel room, but it's great I could speak with you today. My name is Ligia Kornowska. I am a managing director of Polish Hospital Federation. This is the biggest hospital organization in Poland. We associate together between 400 and 500 of hospitals. I am also a leader of AI in Health Coalition. This is the one and only actually coalition that aims in implementing and developing artificial intelligence algorithms in healthcare sector in Poland. And actually we are quite active when it comes to actions on European Union level too. So and one fun fact, right?
Absolutely.
I don't know if it's fun, but actually I am very proud of it that I was a person responsible for first transcontinental tele-CTG on a pregnant woman in Wamba Mission Hospital in Kenya. And the test was actually analyzed by healthcare professionals in Wrocław in Poland after like 5 or 10 minutes. So it was a couple of years ago and I am still proud of it. Thanks.
Excellent. Setting new records. That's absolutely brilliant. Thanks very much, Ligia. April?
Oh, great. Now I have to follow that. Thanks, Simon.
Absolutely. You'll do fine.
Well, hello, everyone, and thank you for the invitation to join this very great panel. I'm April Walker, and I'm the GM for the U.S. Microsoft Technology Centers. And basically what I do is I run an organization across the U.S. of innovation centers and centers of industry excellence. So what we do is we work with a myriad of industries, from healthcare to automotive, state and local governments, banking, FSI, if we call it financial services, and help these companies with digital transformation, how they can achieve their goals, how they can, bring those things to life, emerging technology, security, cloud. How do we bring those things where it becomes very much creating a digital business versus just doing digital? I'm based out of Philadelphia, but my organization is in 15 locations across the US. We also have worldwide locations around the globe, but my remit is for the US only. And my team is comprised of very senior level architects, and they are experts in all things Azure, of course. And many of them have been in roles in industry. So it's a very, very intentional organization to help these companies and ecosystems with their transformation journey. Fun fact about me, now that I have to follow my esteemed panelist, Lydia, I'm going to go the opposite side and just share that I actually have taught myself how to play guitar, and I love country music. So that's something that I do on my spare time.
Oh, fantastic.
And I'm not going to play for you, Simon, so don't ask.
Oh, come now, April. That's for the next panel. We're going to need to pull that up.
There we go.
Thanks very much. David?
Hi, everyone. This is David West. I'm the co-founder and CEO of a company called Proscia. We build software for labs in life sciences and diagnostics pathology that are moving from this paradigm of microscope and glass to a paradigm of images and data. So my background is in computational biology. I studied biomedical engineering at Johns Hopkins and fell in love with this space about 10 years ago, initially coming from a very academic angle, which was a short-lived. I don't have the patience for something like a PhD. And it was started as a humble project with a big vision, turned into my full-time job about 5 years ago. And we're a roughly 100-person company, backed by about 40 million in capital. We've grown quite quickly over the past year and a half. And we're based in Philadelphia, but with employees in Europe and all over the US. Thanks for having me.
And we're still going to need that little fun fact from you, though, David.
Oh, that's right. I almost got away.
You're not getting away that easily.
I'll give a not so fun fact. I broke my left arm 3 times.
Okay. Well, luckily, I guess you're right-handed in that case.
And fortunately, I am right-handed. Otherwise, I think my my schooling would have been stunted.
Right. Well, again, thank you everyone for participating in this. As you can see, what's wonderful about this panel is we have a diverse set of experiences and therefore insights into this kind of extremely diverse but very specific topic as well. Again, COVID has projected kind of how AI and data and big data is going to play an important role in everything going forwards. And you know, the healthcare sector in particular is seeing the initial stages of enormous benefit to this. But we use these words an awful lot. You know, AI, big data. I'd like us to kind of define what we're actually talking about. So April, if I could throw that over to you and really just give us a bit of a sense, you know, what is it, in fact, we're talking about here?
Yeah, I'll put this in very simple terms here. So data actually just fuels the powers of AI, right? So when you think about the differences between big data and AI, from the lens of artificial intelligence, a comparison of this would be that big data refers to the data itself, while AI describes the machine's ability to use that data. We're learning how to act like a human. So sort of creating or recreating the behaviors of a human. They're complementary technologies and they're able to work together in important ways, but AI thrives on that data. And although they are different, AI and big data still kind of work well together. That's because AI needs that data to build its intelligence, particularly around machine learning. And after all of that, it's able to use that data to thrive and create those predictive options for us. Big data can provide all the data needed to train the learning algorithms that you need for AI.
That's very well put. Thank you very much for that. So it's really this idea of, on the one hand, we have this enormous data piece of the puzzle, and you know, for the audience here to get some ideas, just last year, on average, every human being on this planet was generating about 1.7 megabytes of data per second. So just imagine that. Now, what we're also bringing to the table is this notion that we have AI, machine learning, deep learning, and the computational power to actually use that data for something meaningful. So it's these two bricks combined that have suddenly enabled us to take medicine and the healthcare system to an entirely new level, in fact. And that's what we're going to probably be seeing going forwards. I'm willing to bet on it. I hope you are too. So I guess maybe to kick off one of the big questions, it's really to understand within the healthcare system, what are the biggest hurdles when really trying to interact with, again, big data, AI, and how that combination happens? Because healthcare systems tended to be very old school, to say nothing else of it. You know, at least here in France, much of it is still driven by paper forms. It's separate entities. You know, a lack of connectivity between a lab information management system and an EHR, for example, and being able to not only access that but also integrate it all together is extremely effective and important going forward. So, David, maybe you could just kind of give us your perspective on that, and again, from kind of your startup experience, it would be great to get a maybe in the sense of that and also an example.
Yeah. It's interesting. I'm actually in Washington, D.C. right now at a conference around data in healthcare with this kind of marriage between people on the government side, like regulators, et cetera, Congress people, and people on the industry and innovation side, which has certainly got the gears turning in my head as to what's the answer to this question, right? Why is healthcare kind of behind? Is it a regulatory thing? I think the fundamental question for healthcare technology in the current healthcare landscape is or the fundamental sort of characteristic is that you're dealing with life and death situations in a very, very personal way. And so you haven't seen a level of innovation that you've seen in the rest of our lives, where they are more sort of open industries, if you will. The only thing maybe closest to healthcare would be like finance, and that's not even really that close. So when you think about the challenges of getting the data, there's privacy questions. Is the data even available? You have to work together in what has been a relatively fragmented system that has not adopted, technology like, in other areas. And to get AI into practice, you have to deal with the standard for trust is much higher, as it should be, right? Because you are dealing with, generally speaking, like life and death decisions, very, very serious stuff. This is not like, am I more likely to click on an ad or something? This is like, is this patient getting the right treatment at the right time? So I think the gravity of it is the forcing function on the contours of innovation in big data and AI in healthcare.
Very clear. No, absolutely. And Ligia, I'm just curious, you from the hospital perspective, what's your take on this?
Yeah, so if I can add, David told us very important thing, and then when we compare, for example, the amount of money that are put in, for example, cybersecurity in banks, and we compare it with the amount of money that are put in the hospitals when it comes to cybersecurity, it's a huge disproportion, and like financial data are probably as important like healthcare data, right? So it's a comparison that we have this huge contrast when it comes to a Polish healthcare sector. But when it comes to the biggest issue, I think it depends on what part of digital health are we talking about, and it will depend on if we are talking about artificial intelligence or blockchain or telemedicine. But one common thing is interoperability, and we struggle with that a lot. I think the United States addressed that issue better than European Union, but we have a huge problem with that. And when it comes to Poland, it's even worse when it comes to Europe. So it's our huge struggle that we try to overcome, but actually it's very hard to make medical data that will be comparable to each other. And it's very important when it comes to AI, and when it comes to this kind of innovations like personalized healthcare, right? We need medical data to talk to each other, to compare it, and to invest in trials on that medical data. So it's I think most important thing right now.
Interesting. April?
Yeah, I would say my fellow panelists have hit it right on the nose. But I think one of the other key parts of this is that integration that Ligia is talking about, but it's also the implementation. What is the right set of tools to use? Who are the right partners to use? Of course, I'm biased because, of course, I would want you to pick Microsoft. But when you think about when you think about the industry itself, these are the things that it hasn't had to focus on at this level. COVID has accelerated the digital transformation conversation for every industry. There isn't anyone that hasn't been impacted in some way or shape or form. And in this particular case, the healthcare industry really benefits the most for having the right data. Oftentimes when I work with customers, there's no shortage or deficit of data, but it's what data? What's the right data to use? Does that data talk to or integrate with other forms of data? Are you capturing the right metrics? Are you capturing the right tools again? So I think that there's a myriad of things. And candidly, it's an industry that didn't have to necessarily focus on this type of infusion of AI data. There really wasn't that urgency or that sense of urgency. COVID has accelerated that. So now you're sort of caught with, how do I make that work? Am I adhering to the policies, the mandates, whether it be governmental or industry wide? Are you going against any HIPAA rules in the U.S.? So there's a combination of things, but I think more than anything else, when you think about the acceleration and the sense of urgency that COVID has created, many of these industries that didn't have to focus on these things at this level now have to. So now you have to figure out, who do I work with? How do I partner with someone that's going to help me essentially create a whole new model for business, or a whole new model for how I, take care of patients, how I, ensure that the right data is being collected. So it's a combination of just a new paradigm shift for the industry.
April, for what
Oh,
it's worth, I think that Microsoft actually deserves a lot of credit for setting the North Star early on in healthcare. When you think about the early days, or maybe more like the prime of cloud computing, and this is becoming very big, right? Microsoft was very quick to accommodate the needs of the healthcare market, healthcare ecosystem, and enabled a lot of the technologies that we're seeing today. AI applications are very data hungry. They're very computationally expensive. Like a lot of times what I'll tell people about AI is that I think it's easily kind of considered this, we give a lot of credit to the algorithmic side of AI, which in many cases it deserves a lot of credit. There's a lot of amazing innovation that's happening from mathematicians and computer science, mostly in academia, that are innovating on that. But what's enabling that is a lot of data and a lot of computational power. And that wasn't possible in healthcare until like when I was starting my company, I think a little more than maybe 7, 8, 9, 10 years ago. That's when Microsoft was setting the tone in this space.
Yeah, I would agree, and thank you for that. But I would definitely agree. Sure.
Everyone followed. Everyone was a follower. Microsoft was the first. Yeah.
Exactly.
It's very interesting to hear. I guess it kind of brings us on to another topic. I mean, we've been talking about the integration element of this as well. How do legacy systems integrate into this new kind of AI cloud, etc. But I mean, one of the factors that's always kind of there as well is the human element. And I can just speak to kind of case studies that I've seen myself where you're speaking with a clinician and you come to them and say, guys, we've got the greatest product available for your particular indication application since sliced bread. And the first thing they'll look at us and say is, please tell me it's not another web portal that I need to remember the login for. So I guess this leads me on to the next question. What are some of the main stumbling blocks, in fact, that startups and scale-ups, et cetera, are encountering when they're looking at developing new products, in fact, in this kind of AI big data scenario for the healthcare system? And kind of what lessons can we maybe pull out from that to help the audience, anyone with an entrepreneurial spirit thinking about this, say, right, I need to avoid that at all cost. Here's maybe a mitigation way around this.
I'm happy to touch on this again.
Go for it,
kind of stealing the stage too much, but the first thing I think of is, so I'm in the medical imaging space, and AI and medical imaging kind of started in like the radiology world. I'm on the pathology side, which I'll get to in a second. But in radiology, one of the things that you saw from a lot of these, like 100 radiology AI companies over the past few years, and a lot of the things that some of those companies struggled with was this question that you're addressing is like, oh, here's a separate application or a separate system that I have to go into in order to do my work. Interoperability was key. The standards they did exist. I mean, DICOM existed in that universe, but those standards don't evolve very quickly. So I think you saw this kind of clash between these small innovative players and these big sort of technology monoliths. Think like the GEs of the world that have been selling these medical healthcare IT or imaging systems or software systems or whatever into that space. And what's interesting is that in our universe in pathology, it's not like pathology has been digital for 30 years like radiology has. Radiology went digital a while ago, and so those sort of platform layers had already been created, and then the applications had to integrate with that platform layer. In this case, those platform layers are being created right now. Part of our company's strategy is to sort of own that real estate market-wise, and have more control over interoperability and workflow. Because this is a question: how does this fit into my workflow?
Absolutely. Very good point there in terms of the workflow element of it. And Ligia, again, you see a very good portion of kind of what's going on in the Polish ecosystem and beyond. What's your perception of this?
Yeah, actually, as a Polish Hospital Federation, we created a report about medical startups in Poland, top disruptors in healthcare, and we have answers from like 120 startups about how is it when it comes to developing product in Polish healthcare ecosystem and how to implement it. And the biggest struggle, the biggest stumbling block that they are talking about is when it comes to artificial intelligence startups is access to medical data, because right now in Poland, there is a huge problem when it comes to access to medical data, even if we are talking about anonymized medical data. Actually, our Polish hospitals can't share anonymized medical data. It's, I know it's ridiculous, but it looks like it is what it is. So it's a biggest struggle for them. And the second biggest struggle is how to properly communicate with hospital directors to make them implement this innovation, even for the first pilotage, so for the first implementation, even without the cost. So there
Okay,
is,
so even just in the project phase, trying it out, in fact, getting a first trial.
yes, because it brings a lot of risks for patients, for hospital director even. So there is a struggle with that, even if there is a product with CE certification. But when it comes to AI algorithms, we know that like the step plan for getting CE certification is not fit to AI algorithms. So sometimes even if we have CE certificate, it doesn't mean that we are, we have high specificity and specificity. So yeah, so it's hard.
Very clear. No, absolutely. And again, for those of you listening in, the big difference between the way we operate here in the EU versus in the US, of course, you have the FDA to govern many of these rules and regulations. And of course, for medical devices in particular, here in Europe, we have the CE marking process and the medical device regulation, which has come into effect. Now, admittedly, the FDA took a very strong approach to actually saying we have an applicable set of governing rules that we can now apply to any new potential digital application and solution. Here in Europe, we're still undergoing that process, in fact. But it's interesting. One of the comments I keep hearing is actually this idea of access to data, access to standardization, integration, etc. And really this notion of the regulatory importance of it all. Now, April, it's interesting. I mean, one of the notions we kind of already mentioned is this idea of good data in, good decision making out. How can we get startups to be more ready, or at least in a mindset to access data correctly and the right types of data when building a product?
Yeah, I think the first thing you have to do is don't try to boil the ocean. That's the first thing. I think there's this propensity to believe that you can do it all and right away. You just can't. And as Lygia had just said, that this industry, particularly startups, if you will, in healthcare, they're not as risk averse, right? They don't have the luxury of being able to try multiple things and failing and then failing fast, right? And recovering, because it has to be so precise. So, when you think about it, it really comes down to who are you working with to enable you to do these things, right? Don't presume that you can do this on your own. When you're talking about selecting or capturing the right data, you need to first come from the mindset of what is most critical. What is most critical? How do you first enable access to that critical data? How do you secure access to that data? But more specifically, the integration piece of this is the piece where you have to really lean on partners. This is where you have to lean on those that are more versed in those areas. I've seen, one of the other roles that I play is I'm an adjunct professor at Drexel University, where I teach digital transformation and AI, coincidentally. And when I speak to and it's part of their executive MBA program. So I work with a lot of C-suite in my class. And a lot of folks that are in these different industries, the first thing, and startups, one of the first things they want to do is do it all. But they're not aligning themselves with the right expertise in some cases, or there is this overwhelming need to do all of it with multiple engagements or multiple partners or multiple tools. And that interoperability that David's talking about, that's very, very key. So you want to be thinking about what's most critical, and more specifically, who's going to help you Who are you aligning with and partnering with to help you identify what is critical, and also how do you integrate those systems within your organizations, within your hospital, within your institutions, within your startups? Because again, and look, it's not lost on me that the startups are not coming from, really large bags of money as well. So you want to create and infuse the most cost efficient ways of doing this. And that's where your partners are really going to be key.
Very clear. And again, I mean, this just goes to the point, I guess, that we are dealing with an extremely complex industry where, again, we are constantly working with this notion that anything that a company or a product will do could impact a patient's life. So, in terms of our regulatory compliance, our proof of evidence, our proof of efficacy, and just
Mhm.
safety is paramount in all of these kind of aspects of it. Now, navigating all of this, a person, and I'm hoping there are a few here in the audience who have got entrepreneurial spirits and are thinking, yes, I can see myself developing a startup or product here because I would love to see it in the future. Um, what are kind of some of the key lessons you would say that you've seen that should be taken into account early on so that you're starting to make the right decisions early? You begin maybe to have the right processes, etc., in place. And again, April, you're thinking about this from a Microsoft, what can we bring to the table, but just beyond that as well, other elements that they should integrate along the pathway.
So I guess it just depends on the outcome you're seeking, right? And that is what is your. I always think about things in terms of reverse engineering. What's the outcome that you want to achieve, right? And again, it really is that alignment. But I would also add, and it's something that I should have said before earlier, is that you have to have a focal point of what success looks like, right? For your company, particularly a startup. Um, there's not a lot of runway to make a lot of mistakes, right? And recover because that's costly for sure. So having a very laser focused intention around what success looks like, what are you willing to do, and where are you willing to sort of pivot when it's necessary? I think those things are most key for the startups. I always say that for those that I have worked with that are in the startup community, my hat goes off to them because I really could, I don't have the bravery or courage to do that. But in this particular, area specific to healthcare, safety is an issue, right? This you're talking about people's lives. If you're creating tools, and any type of particularly digital tools that help to manage, navigate, predict illnesses. I mean, we think about there's a current very famous case lawsuit that's going on right now. I don't have to say the names, but I think we all know what I'm talking about. And for those that don't,
Good
just
book, no?
just
A good
Google.
book was written about it.
Yeah, and some documentaries, right? So you think about, that's a perfect lessons learned, right? That is one thing that you want to. Then invest. What are you looking to do? And are you being mindful of those outcomes? And what are they using to help you to grow their businesses, right? What tools, and again, to alignment. I think someone probably needs to be removed,
David,
but
yes, would you
needs
mind?
to, so there has to be this alignment, right? Both internally and externally about what your plan is, and be very intentional about what those outcomes are.
Very good. Yeah, absolutely. And this is something I can only agree when we're looking at startups from an investment perspective, it's clearly understanding, have they defined what is their minimum viable product? What is
Right.
the actual clinical unmet need? And what is their claims going to be, in fact? And I guess, David, to your kind of how you've gone from project conception all the way through
Yeah.
to basically now at this point deployment, what was kind of some of the major points along that journey?
Yeah. I actually want to tie together two concepts that April talked about, which is one is like, what's that goal or that North Star? And then two is kind of this idea of stepping yourself into that. So I think, there's this analogy that I always think of, which is like, have you ever seen there's that video of a tiny, tiny domino that's the size of like a grain of rice, and then a giant domino that's probably like 100 pounds at the end. But they tap that tiny domino, and there's bigger and bigger dominoes along the way. Actually, there's a ratio between the size of the domino and the next domino. It's something like 1.5. If it's 1.5 times bigger, if it's more than 1.5 times bigger, it won't knock it down. If it's less than that, it will knock it down. And I think about startups kind of in the same way. So you need to do two things. Number one is you need to make sure that you've defined what's that big domino at the end that you want to knock down. Like what direction are you going into? And reverse engineer your way back towards that and making sure that you have a stepping stone along the way, whether that's collecting early data that indicates a need, right? Viability. Then maybe, raising capital from that data, perhaps, and then the next step might be doing some sort of proof of concept study or something like that. I'm speaking sort of in general terms. For us, I'll speak in very very broadly, but specifically to Proscia. When I think about our master plan, like step one is we need to transition pathology from this glass-based discipline to this image-based discipline. And step two is we want to use that data to build lots of new technologies that change the way we think about cancer by automating diagnostic processes and, introducing new kinds of diagnostic insights from image-based biomarkers or something like that. And that's it. You need a ton of data to get there. You need a lot of capital. You need a lot of regulatory expertise. You need a strong customer base. And so what we started with was this platform, and we sold it into life sciences where the regulatory barriers were low. And we used that capital to sell into the clinical market where the regulatory barriers were higher. And actually at the time when we started the company, totally undefined. Now they are. So we've built that momentum. And now as we're growing into the diagnostic market, we're using the data that we're capturing, from this customer base and our partners to build applications that we layer back into that customer base across life sciences and diagnostics. And this is the case not just for healthcare, but this is general good startup advice. Look at Tesla. Their master plan was not, we're going to mass produce an electric car for everyone in the world. It was, we're going to build a really high-end car, Tesla Roadster, and then we're going to use that capital to build a medium car for, somewhat rich people. And then we're going to use that capital that we make from that phase of our plan to create the everyman electric car. And you have to do lots of things along the way, like build charging stations, etc. Big change takes time, but they set their bar early on. They said, we're going to build an everyman's car, everyman's electric car, but we're going to start small and we're going to create momentum along the way.
Okay, no, very clear. And Ligia, how do you kind of see this percolating, I guess, into what you're seeing?
Yeah, so from my perspective, the most important thing when it comes to startups, apart from people, of course, that are creating the startup, is flexibility. Because in Poland, we have many of startups that created great products, sometimes the first one in whole Europe, but actually they have imagined something about our Polish healthcare system, and they imagined, for example, that it can be financed from public funding, and for the most times it's not going to happen. So they have to be flexible. They have to be ready to change their business model to make it more sustainable. And I think it's the most important thing when it comes to Polish startups, and from my perspective.
Okay. And I guess one thing that always kind of strikes me is as well, we're seeing so much innovation, we're seeing so much data generation on the one hand, we're seeing so many different AI approaches being brought in. I mean, at the end of the day, it's taking data, analyzing it, and having an output, and hopefully something that's actionable. Now, we've kind of touched on this subject that I kind of want to explore next, which is clinical adoption. And this is clinical adoption on the one system as a healthcare system on the whole, as a hospital center, and then also just from an actual person as a clinician at the end of the day. Now, I'm really curious to get your perspectives of what are the biggest hurdles that, again, startups, scale-ups in the space are really facing when they're going towards this idea of we need to initially get a clinician to buy into this, then eventually a hospital system, and eventually an entire healthcare system. What's that kind of first momentum they need to go through, and how can they build a process to actually get the entire way? Ligia, if again your perspective from the Polish system would be brilliant to start with.
So we have a great example because primary care in Poland. In primary care in Poland, we provided services 100 in person. And after only 2 or 3 months of COVID pandemic, we changed a whole way of providing services, and we actually provided 80% of services telemedically. And what is the most important there? 99.7% of this telemedical services were just telephone consultation. So it's telemedicine. It's the wrong definition of telemedicine, and it was like that because of the lack of IT solutions and because of the lack of healthcare professionals' educations. And we actually right now in Poland struggles with some regulations that will block telemedicine in primary care, and it's it's the another side of it's another side of the problem, and it looks like that because of wrong definition of telemedicine in Poland that was understood. So
Okay, so this is almost a problem of just a digitization of an existing care pathway, not necessarily bringing in completely novel and disruptive technologies, in fact.
yes, and healthcare professionals weren't ready for that adoption of new technologies. And we are talking about, for example, video conferences. So it's not a big deal, right? It's not artificial intelligence. So education is very important here, and without that, we can really mess up.
Okay, so it's educating, in fact, the entire workforce, the healthcare system as to one, the technologies exist, and secondly, this is how you can actually apply them and use them. April, would you like to continue from your perspective?
Yeah, I'm glad she brought that up because it's not nuanced to this industry, right? When we talk about the gap that, if you will, for bridging those gaps and the lack of skills and education in this space, particularly around big data and AI, it's a wide gap, and without having that very comprehensive pool of skills and talent within whatever ecosystem that you're in, it's going to create an inability to really capitalize or leverage the power of things like AI tools, machine learning and AI, and being able to create predictive analytics, preventative analytics, all of those great things that healthcare really needs and thrives on. Without that education and the ability to have a very informed workforce, clinical staff, it goes all the way up to the top, from your healthcare administrators to the IT organizations that are within your institutions. And in particular, when you are a startup and you're creating tools for the healthcare industry in particular, again, going back to Lygia's point, if you don't have the right training, the right skills, the right education, it's not going to work, right? You're not going to deliver on that promise.
Absolutely. No, very good points there. Very good points. David, following that kind of thought, I mean, something I remember always seeing when we were talking and pitching to new technologies and things like that to clinicians was always a certain reticence to change from this is how I've been doing something for 20 years. Obviously, depending on the clinician you're coming into contact with and discussing for the first time. I once, to your radiology point, actually discussed with one about a new radiology and analytic point of view. And this radiologist quite frankly said, there is no way you're going to ever find a technology that does this better than I do, at least not in the next 10 years. That was 9 years ago. I think we've proven him wrong several times.
Yeah.
And I'd just love to know, one, what has been your experience in terms of reticence? And then also, what has been the method or the need that you've been able to push to kind of convince people to actually say, actually, I went from a skeptic to a complete believer that this is a very important technology going forwards?
Yeah, it's interesting. In our space, we're seeing this play out right now. In pathology, there's sort of this mentality amongst the pathologist community that from my cold dead hands, you're going to take my microscope. Right? I remember watching the Super Bowl last year, and they have all these big high profile commercials, and one was from the life sciences companies of America, and they do this montage of people doing science and medicine and whatever, and the microscope was featured in 3 out of maybe 30-40% of those little clips. The microscope is very ingrained into the culture of medicine and life sciences, especially within pathology, within our specific space. It's built around the microscope. That's a very, very hard cultural change. And we're seeing this, this shift towards, hey, you know what? I was a little bit skeptical of this digital pathology thing. I was skeptical of technology, especially skeptical of AI, to, if I don't do this, I'm going to miss out. And I think there's a good reason why the healthcare community is hesitant to change. I mean, it comes back to that point we were talking about before. You're dealing with matters of life and death. There's a reverence for the standard of care, right? We call this the standard of care, which is essentially means the way that we've been doing it. We want to keep doing it that way, right? And maybe any adjustments to that need to be gradual or have some sort of reverence for that same standard of care. And so I think it's that culture of medicine that makes this challenging. But part of this is a risk of being overly brutal with it. Like there's a little bit of kind of fear-based messaging, which is that if you don't do this, you're not going to keep up in the 21st century. Like your peers will be better than you. You don't want to be that dermatologist who's still writing paper reports when all the other dermatologists are doing using electronic medical records or something that we saw that play out over the past 15 years. So it is challenging, but as a company, what does it start with? It's not just like I'm going to go in and I'm going to try to scare you, right? I would never do that. Like it's all about trust at the end of the day. Great data, great science, proof points saying, look at who else is doing this. So it's not this sort of aggressive, like I'm going to scare you into it. It's more like, look, everyone else is doing it. You can do it too. And that's not easy, right? It's a bit of a chicken or the egg problem. When you're hearing me say, well, you have to point to other people that are doing it. And you're asking yourself, well, how do I get even the first person to say they're doing it? And that's challenging, but you have to find those in that classic adoption curve. There's like those innovators who are going to be open to new technology. They exist. Find those people and then use those people to find the early adopters and use those people to find the early majority. And by the time you're well through that early majority, the late majority won't want to miss out and they'll want your technology too.
And it's also, I guess, a big piece is engaging as well with KOLs, so key opinion leaders, making sure that those that are writing guidelines, kind of creating those and saying, okay, the standard of care of 2015, that was this. Now we've come into 2021, and of course, the standard of care must evolve with that time. Getting yourself into those kind of discussions as well, I think, is extraordinarily important. April, you wanted to add something.
I wanted to say, because David said something, we said many things that are very critical and very key. But one thing in particular that you talked about was the culture, right? There's a culture shift, there's a paradigm shift in the way that these models work, that these structures, these constructs work. And it's very, very clear that there will be some that are willing and able to very quickly adopt to the new norms. And then there will be others that just don't. So I thought that was very key, what David said, particularly around culture.
Yeah, April, just going back to like our earlier conversation around Microsoft being an innovator, I think there's a very specific example here where Microsoft was willing to sign BAAs, which are these like agreements that HIPAA requires with their hospital customers before Amazon was. And so it was that sort of like mutual trust that allowed Microsoft. And by the way, you knew this from the inside out. I was only looking at this, talking to customers. Like I was at Johns Hopkins, and Hopkins was saying Microsoft was awesome. They were willing to sign a BAA, and Amazon would have never done that with us. Not to dig into Amazon too much, but like that sort of trust fabric, where we say, yeah, you can trust us, and we're willing to kind of put some of our own reputation on the line or whatever, liability.
Yes, an emphasis on basically this protection side of things. But I mean, it's a very important point there you're bringing up, David, because I mean, the reality is as well, as we've been advancing through the healthcare system and also kind of developments over the last 50 years, data protection, personal privacy, etc., has become extraordinarily important. And I would argue to a certain degree, now that we are at an age where sequencing is available in mass, it's basically become commoditized. We have other forms of analytics being able to track, movement, where are we actually present, our consumption of various different products, etc. All of these things are building up these virtual and digital profiles, in fact, of us. And from a security perspective, this is growing in terms of importance because we're even starting to see things like insurance companies, et cetera, wanting to access this data. So I'm curious to see and kind of hear all of your perspectives about where will this shift trend tend to go towards over the next years. Will we, see an openness towards this sharing of the data and kind of a personal level and then on a much more bigger global level? Or will we start to see more kind of siloed or country specific or even state specific, I guess in the US, focus means of trying to keep it in-house and almost segmented, in fact, in that space? April, you're shaking your head.
Yeah, because the first thing that comes to mind is the advent of COVID. Now that we all, many of us are struggling with how do we capture proof of vaccination, right? These are mandates in many cases, and this is going to be a global thing. It's an interesting thing where we have this dichotomy of keeping your medical information private. Yet in this regard, you're asked to prove through some form that you've received a vaccination to enter not just the workforce or your workplace, but, public services, walking into governmental buildings, going into restaurants. So there is this paradigm shift in what is private and what isn't. And I think that's going to be something that as a world view, we're going to have to really grapple with that. I don't know about the rest of you, but it is something that I know many companies, industries, particularly in the tech field, I think it becomes a little bit easier in some sense in terms of hybrid work, right? If you are a developer, you can work from home. If you are a nurse, a doctor, you kind of have to go into the hospital. We see cases in I believe it's in New York where there are many clinicians that refuse to get vaccinated, so they lost their jobs. And then there's that added component of, are you willing to share that data? Are you willing to provide proof of something that essentially would ordinarily be a private matter?
So
Vicky, do you?
yes, when it comes to Europe, I think we are very strict and cautious about data privacy, our privacy, and we have general data protection regulation, popular GDPR, and we actually are very happy about it and we follow it. Actually, it's a great regulation, but it can be vague sometimes, especially when it comes to hospital directors and doctors. So we, in Poland, as a Polish Hospital Federation and 5 other organizations, created a code of conduct for healthcare under Article 40 of GDPR. So it's co-regulation. It's not only guidelines for hospitals how to protect medical data, and not only medical data, but personal data of patients. And actually, April, Microsoft was one of the founding father of the code of conduct. So we cooperate with Microsoft Poland closely, not only in code of conduct, but actually it was a huge success because it was first or second code of conducts for healthcare in Europe, and it was accepted this year. And actually, 3 weeks ago, we are rewarded by Emerging Europe. We gained the first place in modern and future-proof policy making. So it's like an example of policy making when it comes to data protection. But what I wanted to say, if we want to exchange medical data freely and to have an access to medical data for AI algorithms, but not only for AI, for personalized healthcare, or actually every innovation in healthcare, because all medicine is based on the data, right? We have evidence-based medicine. We have to find a way to collect patients' consents for giving away their medical data, even their personal medical data, because firstly, it will be harder and harder to anonymize medical data. Right now, it is possible, but it will be harder and harder. And the second, because we are very cautious about our data and about our privacy, we have to let people decide if they want to share their medical data. And as a Polish Hospital Federation and couple of other organizations, even with patients organizations, we are now creating Donate Your Data Foundation, which will be trusted third party that will collect patients' consents for sharing their medical data. So it's a European concept, because it's working in Estonia and in Finland, I think. but we still struggle with creating this kind of solution for whole European Union and for Poland especially. So we'll probably start our platform next year. So for sure, I will send you a link to check how is it going. But yeah, we have like huge plans, and the whole platform will be based on the blockchain technology. So you cannot like erase data or manipulate the data about patients' consent. So we do a lot to build that trust, patients' trust to that whole concept and technology. So yeah, we
Excellent.
believe that it's an only option actually.
Yeah, going forwards, I think we're going to see more and more of these types of initiatives having to come into play. Otherwise, we're going to either stifle innovation or, in fact, open up, potentially massive amounts of personal information without the consent being required. Now, I just want to flag we have about 8 minutes left. And Angela, if anyone has any questions to the panel, we'd love to hear them as well.
All right, feel free to type any questions in the chat or unmute yourself. Does anyone in the room have any questions?
Maybe whilst you're, oh yes, go on.
Okay. Thank you very much. I appreciate your comments about selecting what data to use to feed AI engines, but I was wondering about the totality of the data available, whether you're looking at unstructured data, structured data, because those decisions have significant implications regarding equity and sort of a holistic view of patients and how sort of feeding an ethical AI engine that provides much more contextual data. So I just was curious about your thoughts regarding that. Thank you.
So if I understood this was about data collection from a whole patient perspective, so understanding all of the different data sets we could come together and integrate eventually. So I guess in that sense, if I'm understanding it somewhat more, it's also where are we heading in terms of multiomics-based approaches? This idea of, for example, David, histology being one component. What about bringing in other data sets and how that can work together?
Yeah, I'm happy to comment on this. I think it's kind of an interesting, an interesting question that. Having a conversation earlier today, there's Amy Abernathy, who used to be with the FDA and Flatiron Health, and now at Verily, said something along the lines of, she feels like the frontier of data in healthcare is not about does this data exist, it's about how do we connect this data. And I think that's the nice thing is that we are an increasingly digitized and data-driven healthcare world, and I think we can be confident that it is moving in that direction. The challenge is how do we connect these or create these like longitudinal patient records or something like that. And it's like you look at, I'm not an expert on regulation. We think about like HIPAA, for example. The idea of HIPAA is we're going to anonymize data essentially so that I can't know that David West has some sort of health condition that can, you can manipulate me as my insurance company, or if I was like a high profile senator, you can blackmail me or something like that. Like there's lots of reasons why you'd want to keep your health data private and anonymized. But the challenge is that makes it almost very, very hard to connect that to other data points, because what's that kind of unique piece of information that allows you to create these longitudinal records? And there is technology and solutions around that. I think that's one of the really, challenging things that we're going to have to deal with is connecting it. So I think it's less about it's less about availability and more about creating those connection points, and people who can solve those challenges are gonna create a ton of value.
Clear. So it's this idea not only of the data being available necessarily, actually sometimes it quite is readily so, but being able to draw on each component, in fact, to integrate together into this major, larger data set to therefore become synergistic in its diagnostic treatment decision, whichever approaches we're pushing for.
Yeah, and that's one of the things that I'm really excited about, like in the pathology histology space in particular, as that data becomes available and digitized, is sort of the last like frontiers of digitization in healthcare. How do we link that to molecular data, to other imaging data, radiology, et cetera,
metabolomics, everything else.
Exactly, your Apple Watch data, right? And that's going to be able to give us the surface area to do a lot of really interesting things like find new biomarkers, discover new medicines, accelerate, access to care, et cetera, et cetera.
So that's really interesting because personally, I get super excited when I think of this. The idea of combination of these multi-omics based approaches, whatever they are, in fact, into a much more powerful entity. Now, April, from one of the perspectives, I remember having a discussion with an entrepreneur who was looking to do this, in fact, and the biggest headache they actually had was saying, okay, today we're going to be dealing with radiology data, but very soon we want to integrate sequencing data. And because of these data sets and the way they're structured, the analytical requirements behind them, the structure of their process, the architecture of both the databases that they needed to create as well as the analytical approaches they had to have were extraordinarily difficult just to kind of put together. Now, I'd love to know if you could shed some light in terms of what are some of the key elements that startups should be thinking about when it comes to structuring data sets on the one hand, but I guess also thinking architecture on the other going forwards.
Mhm. It kind of goes back to the earlier point where I was talking about being mindful about your expected or desired outcome, right? And that really is being very intentional about the goals that you have. I would like to backtrack for just 1 second if I could, because the question that was posed to us also infused something, the topics around ethical AI. So I just wanted to touch on that responsible AI, particularly when we're talking about structured and unstructured data and the notion of capturing this data, because we are at a point in our lives. There's a inflection point that we've reached right now where data has to be used for good. AI has to be used for good, and in too many cases, there's inequities in that data that we're capturing, what we're doing with it, and how AI is being infused or used. So I just wanted to address that part of the question that the young lady had asked, but look, it really comes down to a very simple thing, and I know we've all heard this before. It's the KISS model, right? Keep it simple. Be mindful of what you want to do. Be intentional about your plan. David and Liggy and I both, all three of us have spoken about that. Simon, as you as well. The architecture piece of this, some of the things that you want to think about again is who are you aligning with? What tools are you using? What are the actual things that you want to measure and manage in your ecosystems? And again, this is not nuanced to healthcare. It's not nuanced to the startup community. It really is being smart about what your business plan is, what it is that you are planning to do, and being clear and consistent is very critical as well, because those tools, there will be a myriad of vendors and companies that will offer you all sorts of solutions, and I can't tell you how many companies that I've worked for and with and helped to advise today. They have tons of tools on their shelves that are not adding any value, but they certainly have subscription licenses to them. So, you want to be clear about the architecture that you want to put in place, but more specifically, reverse engineer it. Think about what your goals are. What's your plan? What is the product that you want to put out there? And honestly, don't just relegate yourself just to the field that you're in. Do some research and diligence about those other industries that have some of the same outcomes. I think that you would be remiss if you didn't look at some other sort of roadmaps, if you will, of success and certainly of failure.
Very good points there. Liggy, I'm curious from a kind of hospital perspective as well, and how you kind of integrate this future, I guess, of having these multi-omics based approaches. What do you kind of see as potential stumbling blocks, for one, the integration of them, and secondly, for them, to David's point, I guess earlier, of accessing the data sets required to actually be effective?
So when it comes to integration, still it's interoperability, and it's like comparing one medical data created in one hospital to other medical documentation created in the second hospital. But actually, like 2 months ago, we started our program P1. It has this name in Poland, that will allow exchange medical data between hospitals, and it's pretty wide, because it's about like diagnostic tests, prescriptions, and even medical notes. So we started to work on that, but still we lack of standardization of medical documentations, apart from DICOMs, of course. And when it comes to access to the data, I think the solution is like creation of this trusted third party that will collect patients' consents for sharing their medical data. The same, for example, as with blood donation. The same as patient can donate their blood, they should have an option to donate their medical data, and it will be actually more and more important, maybe even more important than blood donation in the near future.
Very good. No, I just think one point I'd almost want to echo from that is also when people are thinking about these kind of new approaches, and particularly donating data, I mean, sometimes we can do so without actually realizing it. And quite honestly, a lot of cases we're doing so without realizing. And particularly when we're looking in this kind of an industry, look towards the consumer type approaches as well that are out there. And I'm thinking again of these kind of options that are looking for hereditary analysis, etc., very often asking for a swab or something like that using sequencing. This is enormously powerful data that sometimes people are giving away unwittingly and unknowingly, and we're not necessarily sure always where it's going. So it's more of a point as well, I guess, to the audience to say, think also, what are you already providing? And then secondly, if you're looking from a startup perspective, be sure to also look around in terms of what can you actually access, because there's an enormous set of data out there that you can probably already get to very quickly, just from that perspective. Angela, I don't know how we're doing for time. Could you give me a brief update there?
Yeah, we're actually up on our time now, so we need to wrap it up. But thank you so much, Simon, April, David, and Ligia. This was such a great discussion. So thank you for taking the time to be here.
Thank you.
I think I speak for all of us when I say we've enjoyed it thoroughly. And again, if you have any questions, comments, and want to continue these discussions, you know, we're all here.
Thank you.
Great discussion. Thank you all.
Thank you.
Thank you so much. Thanks everyone for coming.